Policies and procedures. Who needs them anyway? What are policies and procedures? What we're going to talk about, if you're an agency of any type, you require policies and procedures. We define an agency as if there's more than one person. That person, the other staff could be contracted individuals, it could be part-time staff, it could be anyone. If you have more than one person working for you, Delmarva considers you an agency and therefore will be subject to policies and procedures. If you are a solo, that means there's only one of you. And with the exception of the services of ResHab, in-home support, ResHab, supported coordination, supported employment, and supported living services. If you're solo provider of those 4 services, then you do still need to have policies and procedures. Basically, when we're thinking about what policies and procedures are, a policy is basic principles by which an organization is guided. It's how you're going to do something. When you say that you will uphold the rights and privileges of all individuals that you serve, that is your policy as an organization. Your procedure is what you're going to do. By doing that, your directions and your procedures may indicate that on a quarterly basis, we will discuss certain elements of rights and education with individuals. It may be that you will be taking individuals out into the community. However it is that you say as an organization you're going to uphold your own policy. So everybody, generally is the policy is what you're going to do, the procedure is how you're going to do it. What we have next on this next slide are the policies and procedures that are required for those of you that do require these policies and procedures. They can be found in section 3.0 of the core assurances, and they're pretty straightforward. One of the questions before we go much further, I guess I probably need to clarify, is that one of the questions we often get is which handbook are we using anyway? Because there's always some question there. And the reality is that as of, there is a new handbook that has been put into effect. It was made effective July 8th, 2010. So what we have to do in terms of our review process is we can apply the new rules to everything that we look at from July 8th, 2010 forward. However, we still have to apply the old handbook rules to everything prior to that date. So you'll notice on this particular handout that under policies and procedures you'll see that, for example, the first one, use of the personal outcome process, it says over there, deleted, effective 7/8/2010. Now they're still applying the person-centered approach, that is still there. But the state is no longer working with the Council on Quality and Leadership, and one of the changes that they've made in this current handbook was to take out the words that reference personal outcome measures. It's still very important to have a person-centered approach, and there's a number of ways that providers can go about that, or solos or agencies. It doesn't really matter. Health and safety. It's pretty broad. It needs to include the abuse, neglect, incident reports, Bill of Rights. So this again would be a policy where you would state as an organization, here's what our policy on these topics is, and the procedures would be, here's how we're going to make sure that we do this. You may want to make sure that your Bill of Rights is signed on an annual basis. That's one of the things that's expected, and that would be something that you could easily find in your policy and procedure on that topic. I always like to think of the policies and procedures as kind of it's your employee manual. It tells you what you're expected to do and how you're expected to act as an employee or an employer. It's kind of a map that you can always refer back to and say, this is what I said I was going to do, am I doing it? The other policies and procedures are medication administration. This one comes up quite often with providers that don't administer medications. Typically, support coordinators aren't going to administer medications. With some of the behavior analysts and behavior assistants, that's typically not in the scope of what they do. They do still need to have a policy and a procedure, even if the policy states our policy is not to administer medications. Even if you're a provider of companion, an agency provider of companion, or in-home supports or any of those smaller services, it may still be your policy to not administer medications. There are a number of providers that just don't want to get involved in any of that, so they don't. But the policy has to be in there whether you administer medications or not. The next one is transitioning between providers. This is where you would want to be able to illustrate and demonstrate how you assist someone if they choose to go with a different provider. What is your role in helping that person transition to that next provider in a smooth manner so that they don't lose, there's still continuity in their life. and that everything that the new provider needs to support that person best is made available to them with the person's permission, of course. Grievance procedures. You'll see out there to the right, all providers, big and small. This is the procedure that all providers must have, whether you are a solo or an agency. Everyone has to have a grievance procedure. Another part of that is that in addition to the grievance procedure, you need to have a grievance log. And again, one of the questions that we hear a lot is, well, I haven't had any grievances, why do I have to have a log? Part of the procedure is to have a log. It could be a blank log, and in most cases it is. You just are looking to see that if I had a grievance, where am I going to document it, and are the components that are required per the handbook identified on that grievance log? And again, it's a good opportunity to look at what is my follow-up if there was a grievance? How do I make sure that things were handled appropriately? Were there any further steps? Was it resolved? Was it not resolved? The next one is the annual self-assessment. Got a slide dedicated to that, so we'll get into that one in a little bit. And then the table of organization. Yes?
I just had a quick question about the self-assessment. Isn't that the same as a satisfaction survey?
Self-assessment is not the same thing as a satisfaction survey. Satisfaction surveys are a piece of the self-assessment, and we're going to be getting into that next. I believe it might even be our next slide. The table of organization, again, is just for group providers. If there's more than one of you, then we would want to see a table, president, vice president, or CEO, CFO, however you have your organization laid out. We want to be able to see that on written down. If you're a solo, doesn't matter if you're a solo of support coordination or supported living or any of those services that also requires policies and procedures, it doesn't make a whole lot of sense to put Kristen Allen, supported living coach, and that's it. It's my table of organization. If there's more than one of you, we want to see it kind of spelled out, and that is, again, something that these all can be found in section 3.0 of the core assurances, and they're spelled out pretty clearly. Later on in the slides, on slide number 31 on, we have also included some additional policies and procedures that are still good ideas to have, but they are not identified in the handbook as required to be written in your policies. So, that leaves us with the self-assessment. There it is. Self-assessment. Self-assessments typically are done on an annual basis. At a minimum, they should be done annually. What we're looking for in the self-assessment is record reviews. And the record reviews that you're looking for could be records, or should be records of both the individuals that you serve and your staff that you employ. One of the things that a lot of providers have chosen to do over the years is, based on whatever the current standard tool being used by whoever's reviewing them, whether it be APD or ACA or Delmarva, is they're using that tool as a standard to pull records to review. For example, if I'm an employer and I have 5 employees, I may go to the Delmarva website, pull down their tools, compare those tools and what is expected on those tools to those employees. There's 5 of those five employees' files, to make sure that based on what I'm supposed to have in the file is actually in that file. There's been, again, a number of different ways to do that. You can have your own checklist. You can use the handbook. You want to make sure, basically what you're looking to do is making sure that those employee files are meeting the minimum requirements, that the staff that you have had the proper training, that there's evidence of background screening, that there is, they have the proper education and evidence of the proper education and experience, those types of things. You also would want to do interviews with individuals and the staff again. These are informal. They don't have to be formal interviews. They can just be conversations that you have with people just as you're providing services to them or working with them on towards their goals. They can be more formal if you like, but they don't have to be. A lot of these conversations you may be having throughout the year anyway with the individuals that you work for and the staff that you employ. And if you think, just to kind of document some of those conversations about what people have been happy with and what they haven't been happy with, if they have any, asking them if they have any ideas of how you could improve your service. The third piece of the puzzle, the annual self-assessment, are the satisfaction surveys. Satisfaction surveys should be developed in such a manner that, preferably that they're geared towards the service that you're providing, and that they give you information that you as an agency are going to find valuable when you get it back. The things that are important to you. You may want to know if individuals are happy because does the person always return phone calls? Do they show up to their appointments on time? Are they courteous when they're with you? Do they do the things that you want to do? Those types of questions. A lot of providers have taken it to the next level where there may be a support coordinator, for example, that works with a number of different providers, or with the larger provider. The support coordinators have sent satisfaction surveys actually to the providers that they work with most to kind of build that relationship and see, is there anything that we can do to improve our relationship with you as an organization. So there's a number of, anywhere you can go to get feedback on your service provision, go for it. I mean, that's pretty much what we're looking at is in satisfaction surveys. When you have all that stuff gathered together, the point of doing that is to then bring it together and see if you can identify some trends. You may be able to identify, okay, in my employee files, 4 out of the 5 didn't have their local law review present. So we're missing something, first of all, in our policy and procedure on new hires, but we also need to find a way to make sure we get that fixed quickly and that we don't let it happen again. You may identify in your satisfaction surveys or in your conversations with individuals that certain things came out of those conversations that were consistent across the board, so that you can identify what you can improve as an organization in that regard. You want to develop some type of a quality improvement plan based on that and put it into action. And this is not the same as the quality improvement plan or the remediation that APD will be conducting with providers as part of this new contract. This is something that you do on your own as an organization that you've identified and you want to improve. However these are done, it's about you. The best thing I can suggest to you is to be honest when you're going through a file. Make sure you go through it and you're honest. If these things aren't there, it's your own individual internal report card. So it's only going to do you good to help identify those issues and correct them in the future. And what you're doing is you're essentially finding and correcting errors potentially prior to either Delmarva finding them, or ACA, or Medicaid Program Integrity, or Agency for Persons with Disability. Because that's one of the things that we would look for. If we were seeing a trend out in an organization, we'd say, well, what systems do you have in place to prevent these things from happening? And that also may help you determine that that system obviously is broken and isn't working. Or it may say, everything is perfect, and you can say that's because we have this system in place. Some of the larger providers may choose to do some of this work on a quarterly basis over the course of the entire year, because they do serve so many people, and it seems kind of overwhelming to try to do an annual self-assessment on your entire organization in the last month prior to your 1-year mark. So however you spread it out also is up to you. Again, it's your tool. It's your